Hello everyone and welcome back to my channel. Today we are diving into a topic that affects us all at some point in our lives. Yes, fever. In this video I will be breaking down everything you need to know about fever. So grab your notepads because we are about to uncover the fever facts you have been curious about. Now, first of all, we need to know about the body temperature. The body temperature refers to the temperature of the viscera and tissues of the body. It is kept within the normal level by maintaining a balance between the heat gain and heat loss, which is regulated by the hypothalamus. The body temperature is best recorded with a mercury thermometer, which should be kept in position for about a minute. Usually, temperature is recorded in the axilla. However, if there is a lot of perspiration, oral temperature should be taken. In cholera, rectal temperature is recorded, which may be high, whereas the skin temperature may be subnormal. The normal body temperature varies from 36 degrees Celsius to 37.5 degrees Celsius. There is normally a diurnal variation of 1 degree Celsius, the lowest temperature being between 2 to 4 am and highest in the afternoon. Now, in this table, we have a list of various terms along with their corresponding temperature in both degree Celsius and degree Fahrenheit. We'll be going through each term one by one. First one is hypothermia, 35 degrees Celsius or 95 degree Fahrenheit. Subnormal, 35 to 36.7 degrees Celsius or 95 to 97 degree Fahrenheit. Normal, 36.7 to 37.2 degrees Celsius or 98 to 99 degree Fahrenheit. Mild fever, 37.2 to 37.8 degrees Celsius or 99 to 100 degree Fahrenheit. Moderate fever, 37.8 to 39.4 degrees Celsius or 100 to 103 degree Fahrenheit. High fever, 39.4 to 40.5 degrees Celsius or 103 to 105 degree Fahrenheit. Hyperpyrexia, more than 40.5 degrees Celsius or more than 105 degree Fahrenheit. Okay, so let's move on to the next slide. Now we have the types of fever. First one is continuous fever. The temperature remains above normal throughout the day and does not fluctuate more than 1 degree Celsius in 24 hours. Example, lower pneumonia, typhoid, urinary tract infection, etc. Second one is remittent fever. The temperature remains above normal throughout the day and fluctuates more than 1 degree Celsius in 24 hours. Example, typhoid, infective endocarditis, etc. This type of fever is most common in practice. Third one is intermittent fever. The temperature is present only for some hours in a day and remits to normal for the remaining hours. When the spike occurs daily, it is quotidian. When every alternate day, it is tertian, and when every third day, it is quartan. Intermittent fever is seen in malaria, kala azar, pyemia, septicemia, etc. Fourth one is hectic or septic. The temperature variation between peak and bottom is very large and exceeds 5 degrees Celsius. Example, septicemia. Fifth one is Bell-Epstein type. There is a regular alternation of recurrent bouts of fever and afebrile periods. The temperature may take 3 days to rise, remains high for 3 days, and remits in 3 days, followed by apyrexia for 9 days, seen in Hodgkin's lymphoma. Hodgkin's lymphoma is a type of cancer that affects the lymphatic system, which is part of body's germ-fighting immune system. Sixth one is low grade fever. Temperature is present daily, especially in the evening for several days, but does not exceed 37.8 degrees Celsius at any time. Usually, it does not indicate disease, but it is commonly present with tuberculosis. Now comes the causes of fever. There are several causes of fever. First one is infections. It may be bacterial, viral, fungal, parasitic, etc. Second one is neoplasms. Neoplasms are any abnormal growth of tissue in a part of body as a characteristic of cancer. Third one is vascular, acute myocardial infarction, pulmonary embolism, pontine hemorrhage, etc. Fourth one is traumatic, crush injury. Fifth one is immunological, drug fever, serum sickness, etc. Sixth one is endocrine, thyrotoxicosis, Addison's disease. Seventh is metabolic, gout, porphyria, acidosis, dehydration. Eighth is hematological, acute hemolytic crisis. Ninth, physical agents, heat stroke, radiation sickness. Tenth is miscellaneous, habitual hyperpyrexia, cyclic neutropenia, etc. Now, moving on to the next slide, we have special types of fever. First one is fever with rigors. This occurs in malaria, kala azar, filariasis, urinary tract infection, etc. Second one is fever with herpes labialis. In this, the elevated body temperature may activate the herpes simplex virus and cause small vesicles around the angle of the mouth. It occurs with pneumonia, malaria, meningitis, and severe streptococcal infection. Third one is fever with rash. This is seen in chickenpox, smallpox, measles, rubella, typhus, allergy. Fourth one is fever with membrane in the throat. It occurs in diphtheria. In diphtheria, a sheet of thick gray matter covers the back of the throat, making breathing hard. Fifth one is fever with delirium. This is seen in typhoid state, meningitis, pneumonia, etc. Sixth one is PUO, that is pyrexia of unknown origin. In this, the temperature is more than 101 degree Fahrenheit on several occasions. Duration is more than 3 weeks and duration is more than 1 week in hospital with failure to reach diagnosis. Next, we have hyperpyrexia. Hyperpyrexia is said to occur when body temperature is more than 105 degree Fahrenheit. Causes may be tetanus, malaria, septicemia, heat stroke, encephalitis, pontine hemorrhage, etc. Then, benefits of fever. In some human diseases, fever is beneficial. Example, widespread cancer. Fever was often induced in these diseases by injection of milk protein or BCG vaccine. It has been suggested that fever is associated with release of endogenous pyrogens which activate the T cells and thus enhance the host defense mechanism. Next, we have the harmful effects of fever: hypercatabolism, nitrogen wastage and weight loss, fluid and electrolyte imbalance due to sweating, convulsions and brain damage, circulatory overload, arrhythmias, etc. Before we explore this beautiful chart, let's lay the foundation by discussing the different types of fever. So, basically, the fever has been classified into two types: short duration fever and long duration fever. If short duration fever is without specific symptoms, then there is influenza, which is a common viral infection and is also known as flu. And if it is with specific symptoms, then what all symptoms are there? If there are other signs of viremia, that is presence of viruses in blood, or progressive weight loss or high risk behavior, that is acts that increase risk of diseases, example violence, alcoholism, tobacco use disorder, risky sexual behaviors, and eating disorders, then there is HIV infection. If there is throat pain, difficulty in swallowing, then there may be tonsillitis, pharyngitis, diphtheria, infectious mononucleosis. If there is cough, chest pain, rusty sputum, then there is pneumonia. If there is rigors, that is sudden feeling of cold with shivering and then rise in temperature with copious sweating, that is sweating in large amount, and if it is present along with the burning micturition, then there is urinary tract infection, and if burning micturition is absent and fever occurs on alternate days, then the person is suffering from malaria. And if there is lymphedema and eosinophilia, then the person is suffering from filariasis. And if there is abscess, then the person is suffering from septicemia. If there are rashes and if it is due to the drug ingestion, then that is drug allergy. And if drug ingestion is not there, then that is measles or chickenpox. Now, long duration fevers. If there are abdominal pain, rose spots, that is, slightly raised small reddish pimples on the chest due to Salmonella typhi, or bradycardia, that is, decreased heart rate, then that is typhoid. If there is headache, vomiting, neck stiffness, then the disease is meningitis, that is, the inflammation of meninges. If there is valvular lesion, that is, any valve in heart is damaged. Petechiae, that is, small red or purple spot caused by bleeding into the skin, or clubbing, that is, enlargement of ends of fingers or toes, or palpable spleen, then the disease is endocarditis, that is, the inflammation of endocardium. If there is cough, loss of weight, anorexia, then there is pulmonary tuberculosis. If there is abdominal pain, past history amoebic dysentery, then there is amoebic liver abscess. If there is hepatosplenomegaly, that is the inflammation of both liver and spleen, and lymphadenopathy, that is the swollen lymph nodes, then there may be lymphoma or leukemia. So let me tell the difference between the lymphoma and leukemia. Leukemia originates in bone marrow and spreads through bloodstream, whereas lymphoma originates in lymph nodes or spleen and spreads through lymphatic system. Then if there is cough, hemoptysis, that is coughing up blood, or breathlessness, then there may be brucellosis or other occupational hazards. Brucellosis is also known as Mediterranean fever. It is an infection that spread from animals to people mostly by unpasteurized dairy products. Now, in the last, we have some drugs that cause fever. Those are aminosalicylic acid, antipsychotics, amphotericin, penicillin, antihistamines, and novobiocin. So, there you have it, everything you need to know about fever. Knowledge is your best defense against illness. If you found this video informative, please give it a thumbs up and share it with others who might find it useful. Thanks for watching, and remember to prioritize your health. If you have any question or would like to share your own tips, feel free to do so in the comments. Stay well, stay hydrated, and I will catch you in the next video. Till then, take care. Bye.